Hello, everyone. Welcome to our channel and the long history of humanity's struggle against disease. There is a small white template that has become a constant presence in almost every household's medicine cabinet, and that is aspirin. Today, let's uncover the untold story behind this little pill. As early as around 2000 BC, the ancient Sumerians and the Egyptians discovered that willow bark possessed pain-relieving powers. By the 5th century BC, the famous ancient Greek physician Hippocrates formally recorded methods of chewing willow bark or drinking willow leaf tea to ease the pains of childbirth and reduce fever. Although this natural remedy was widely used across ancient civilizations, it remained a crude folk herbal medicine for a long time because the concentration of active ingredients in willow bark was extremely unstable and the taste was incredibly bitter. The scientific turning point arrived during the chemical revolution of the 18th and 19th centuries. One day in 1757, Reverend Edward Stone was strolling through the countryside between Oxfordshire and London, just as he usually did. For some unknown reasons, he felt compelled to peel off a piece of willow bark and put it in his mouth. "I accidentally tasted it," he later described, "just like accidentally tripping over something." An ancient principle flashed through Stone's mind. Many diseases carry their own cure, or rather, the antidote is always found near the poison. While this idea sounds a bit mystical, it was quite popular at the time. He reasoned further. Since malaria often occurred in marshy areas where willow trees commonly grew, willows was very likely a natural remedy for the disease. To test this bold hypothesis, Stone gathered a large amount of willow bark during the summer and dried it by a bakery oven. 3 months later, he ground the dried bark into a powder and began trying it on local patients suffering from malaria. "I gave this bark powder to about 50 patients and expect for few cases of autumnal and content malaria, all were cured," Stone later wrote in a letter to the Royal Society. This claim would be exaggerated, since even modern quinine cannot guarantee a 100% cure rate, but the willow bark did indeed prove effective at reducing fevers. Stone's discovery opened a new era for willow bark as a medicine. By the end of the 18th century, willow bark had become a widely used medicine in Europe. Entering the 19th century, with the advancement of chemistry, scientists were no longer satisfied with using crude bark powder and began trying to isolate the active ingredients. In 1826, French chemist Henri Leroux first extracted an active substance from willow bark. 2 years later, Johann André Brunner of Germany successfully purified this substance and named it as salicin. In 1838, Italian chemist Raffaele Perea first hydrolyzed and oxidized salicin into salicylic acid, laying the chemical foundation of the precursor of aspirin. However, while these substances were effective at reducing fever and pain, they came with several side effects. They irritated the digestive tract, causing stomach pain, bleeding, and even death. In 1853, French pharmacist Charles Frederic Gerhardt found a way to reduce irritation of salicylic acid. He acetylated it through a chemical reaction to create acetylsalicylic acid. Unfortunately, after completing this discovery, Gerhardt moved on to another research. By the late 19th century, doctors discovered that salicin and salicylic acid also had significant effects on another common element, rheumatoid arthritis. It was German chemists who truly set aspirin on the path to modern industrialization. In 1853, Hermann Kolb invented a method to manufacture salicylic acid directly from coal tar, so there was no longer a need to bother willow trees. Once industrial production was achieved, in 1874, salicylic acid became very inexpensive. By 1897, chemists at the Bayer Company had developed several derivative versions of salicylic acid, hoping to find the one that kept all the healing properties while causing the least harm. Among the many compounds, acetylsalicylic acid, the same substance Gerhardt discovered 55 years earlier but left undeveloped, stood out. Chemists Arthur Eichengrun and Felix Hoffmann ignored opposition and secretly conducted clinical trials at a hospital in Berlin. The trial results exceeded exceptions. The drug was not only remarkably effective at relieving fever and pain, but its side effects were much smaller than those of ordinary salicylic acid. Eventually, the head of the company, Duisberg, ordered new tests which confirmed Eichengrun's findings. Bayer decided to go all in on developing this new drug. Eichengrun named the new medicine aspirin. The A stands for acetyl. Spir comes from the spirio mario, another plant containing salicin. And in was a common suffix for medicines at the time. In 1899, Bayer began mass-producing aspirin, and it quickly became one of the best-selling drugs in the world. As the 20th century progressed, aspirin became the first choice for treating fever, pain, and inflammation. Human understanding of aspirin also jumped from empirical use to the molecular level. In 1971, British pharmacologist John Vane discovered the biochemical mechanism by which aspirin works, inhibiting prostaglandin synthesis to reducing fever, pain, and inflammation. This breakthrough later won him the Nobel Prize in Physiology and Medicine in 1982. Since then, the application for aspirin have continued to expand, from preventing cardiovascular disease to reducing cancer risks. This century-old medicine continues to find a new life. Looking back at the 100-year journey of aspirin, from Priest's accidental tastes, Willow bark to the persistent exploration of chemistry and commercial development by pharmaceutical companies, every step embodies human wisdom and courage. That's all for today. If you found this content interesting and helpful, don't forget to give a thumbs up, subscribe, and hit the notification bell. Thanks for watching, and we will see you next time.